Well, so this was really the summary of our approach to treat cancer, which is based on information theory, and that this is something which is called today precision medicine, which means finding out what is causing cancer, which genes are causing cancer, and the treatment of the genes by using medications which work on the genes, not by chemotherapy, but new generation of medications which are gene-targeted medications and immunotherapy. So that's what we do. And one of the main medications which we are using are those which we discovered, which are medications from anti-neoplaston group. In order to prove that this is effective, this should be submitted for clinical trials, but we know that we can cause malignant tumor to disappear within a relatively short period of time. Usually we see that the tumors are shrinking or are gone within 1 to 2 months. Of course, not in everybody because we are treating very advanced patients, but in many patients that's what we see. And then if we continue the treatment for another 6 to 8 months, then usually the cancer is not coming back. So this is something which we feel is very promising, but it is necessary to have more observation time to find how this is going to work over 10 years, over 5 years, etc. Well, I think the symposium plays a very important part. It's bringing awareness of what is now available and is making people to understand that the right way to combat cancer is to use a combination of various approaches. Not only the treatment, but also diet, but also modification of the lifestyle, exercise, and various other things. So by combining these various techniques together, we can successfully treat cancer patients. Excellent. So I think this was quite a task to organize such event, and I would like to congratulate Ty Bollinger and the team to do it, because it's not easy. Initially, we have a patient who came to us from Europe, from Belgium, who learned about us from your event, and we already have good results in the treatment of his lung cancer. Bureaucracy is trying to force the doctors and patients to use certain treatments the same for everybody, which is good for the big business, not good for individual patients. The patients and the doctors have the right to choose the best treatment for individual, not something which they are told use the same thing for 10,000 people because everybody is the same. This is not true. This is what Soviet Union was trying to say, that everybody is the same and they're good for nothing, okay? No. Everybody is different and precious, and they need individual approach. And that's what government should understand. The doctor should have more freedom, and the patient should have more freedom in selection of medications. And the doctors, because they're fighting for their lives. They're not the property of the bureaucrats. They need to be given the right to try. And that's the new law what has been introduced. Well, I believe that this symposium will play the important part, because it will give the instruction to people about the diet, about changes of their lifestyle, of behavior, and by new forms of treatment which they can try, especially if they have advanced cancer. Absolutely, just I would like the participant to view the recordings, and they can contact us, they can contact the other presenters, and we'll be glad to talk more details and help them.